Pancreatic Cancer by Rhonda Ritter. Pancreatic cancer is often referred to as the silent disease because early detection of symptoms is unusual. When symptoms develop, they depend on where the lesions or tumors are located. If the cancer spreads to areas outside of the pancreas, pain may develop in the upper abdomen and spread to the back. When the cancer cells invade the pancreatic cells that make insulin or other hormones, a person may become dizzy and have chills, muscle spasms, or diarrhea. As the disease progresses, symptoms may mimic those of other diseases and may go undetected for some time. There are several other symptoms that may come with pancreatic cancer that include nausea, vomiting, diarrhea, weakness, jaundice, loss of appetite, pain in the upper or middle abdomen, muscle spasms, and back pain. Cancer begins in the cells in the body and start to grow out of control. There are many types of cancer, but they all start because of the out of control growth of abnormal cells. There are many types of treatable and curable cancers throughout the body. Scientists and researchers have studied cancers for many years and have been able to find the specific causes of most types of cancer. Unfortunately, pancreatic cancer is not one of them. So far, the direct cause of pancreatic cancer is still unknown. Currently, there is no known way to prevent pancreatic cancer, and there is no exact known cause for pancreatic cancer. There are a few risk factors that include smoking, age, diabetes, being male, being African American, family history, and chronic pancreatitis. Other studies suggest that exposure to certain chemicals in the workplace or a diet high in fat may increase the chance of getting pancreatic cancer. Of all pancreatic cancers, 95% begin in the area of the pancreas that helps produce juices to digest foods, while 5% begin in the cells, the islet cells, that produce hormones such as insulin, which breaks down sugars. The pancreas is a gland that is about 6 inches long that is shaped like a thin pear lying on its side and lies between the stomach and the spine. The pancreas has 3 parts: a head, body, and tail. The pancreas has 2 main jobs in the body. First, it is to make juices to help digest food, and second, it is to make hormones, such as insulin and glucagon, that help control blood sugar levels. Both of these hormones help the body use and store the energy it gets from food. The digestive juices are made by exocrine pancreas cells, and the hormones are made by endocrine pancreas cells. In some cases, these cells enter the bloodstream to form new tumors in other parts of the body, such as the lymph nodes and the liver. Pancreatic cancer can metastasize outside of the pancreas and can affect surrounding organs and tissues, such as the nearby lymph nodes, liver, peritoneal cavity, large intestines, or lungs. When cancer spreads from its original place to another part of the body, the tumor has the same kind of abnormal cells and the same name as the primary tumor. For example, if cancer of the pancreas spreads to the liver, the cancer cells in the liver are pancreatic cancer cells. The disease is metastatic pancreatic cancer, not liver cancer, and is treated as pancreatic cancer. Pancreatic cancer can spread into the abdominal cavity, causing liver disease or portal vein thrombosis. Often there is pain in the abdomen caused by the tumor growing larger and pushing against the surrounding organs and nerves. Patients can often experience anemia, anorexia, back pain, bone pain, bruising, bleeding, cachexia, chills, cramping, diabetes, diarrhea, depression, fatigue, fever, hair thinning and hair loss, itchiness, jaundice, loss of appetite, mouth sores, muscle aches, nausea, rash, skin irritation, stool discoloration, swelling during vaccine therapy, urine discoloration, vomiting, weakness, and weight loss. Treatment for pancreatic cancer depends on the location and stage that the cancer was diagnosed. The first goal of pancreatic cancer treatment is to eliminate the cancer when possible. When that isn't an option, the focus may be on preventing the pancreatic cancer from growing or causing more harm. Depending on where the cancer is located will depend on the treatment available. If the cancer has not spread and is contained in the pancreas, Surgery may be an option. Often with surgery, the doctor may decide to use radiation therapy or chemotherapy. Try to reduce the size of the cancer tumor. When surgery is not an option, palliative care is given and pain is controlled with pain medications. The survival rate of pancreatic cancer is fewer than 15% of patients with pancreatic cancer are actual candidates for surgery. Of those who are able to have surgery, 20 to 25% live at least 5 years after the cancer is diagnosed. For those who do not opt for treatment, the median survival from diagnosis is usually less than 6 months.